Why are colon cancer rates climbing, not just among older adults but alarmingly in younger people too? It's a trend that should make us all pause and question, what's really going on? Today we're diving into this critical issue to uncover the truth and challenge the misconceptions that surround colon cancer. Make sure to stick around until the end, as we'll cover the most common symptoms you might be overlooking right now. Colon cancer ranks as the third most diagnosed and second deadliest cancer, but the battle against it is tangled in an industry full of profit-driven motives, misleading ads, and overwhelming information that confuses both patients and healthcare professionals alike. There's a popular belief that genetics are the primary culprit behind colon cancer. While a family history does increase your risk, accounting for around 5 to 10% of cases, that's only part of the story. Genetics may set the stage, but our lifestyle choices are what determine the outcome. Modern research shows that diet and lifestyle are critical in preventing, and even reversing, colon cancer. Antioxidant-rich foods, for instance, are gaining attention for their ability to combat chronic diseases like this one. This isn't just a theory, it's backed by fast-emerging scientific research pointing to where the future of medicine is headed. So, how can you tell if you might have colon cancer? Let's break it down. Colon cancer, it's not just something to worry about when you're older anymore, it's creeping into younger populations too. Can you believe it's now the third most commonly diagnosed cancer and the second leading cause of cancer deaths? That's not just numbers, that's a wake-up call. Every year, more and more people find themselves dealing with the reality of this diagnosis. The alarming part? Many still think it's a disease that only affects older folks, missing early warning signs. And when you miss those signs, the consequences can be life-changing. But why is this happening, you might wonder? Well, we can't pin it all on genetics alone. Sure, some cases are inherited, but a significant part comes down to lifestyle choices. Think about it. How often do we prioritize quick meals over healthy options or neglect regular exercise? These small, everyday choices add up. The scary thing is that while these habits might seem harmless now, they're silently setting the stage for colon cancer to develop, especially when combined with other risk factors like stress and poor sleep. This shift in colon cancer demographics means that staying informed and proactive is more important than ever. But knowing the risks is just the beginning. The real question is, what can we actually do about it? It's not just about reacting when something goes wrong, it's about understanding prevention. So, what lifestyle changes could you make today to minimize your risk? Let's dive into that next, because if we're talking about taking control of our health, it starts with our daily choices. When it comes to preventing colon cancer, diet is one of the most powerful tools in our arsenal. It's not just about eating less, it's about eating smart. Foods packed with antioxidants and anti-inflammatory properties can help protect the colon, creating a barrier against the development of cancer cells. Imagine adding turmeric to your meals. It's a spice known for its anti-cancer properties, and just a pinch daily can make a difference. Omega-3-rich foods like salmon and chia seeds? They're not just trendy, they actively reduce inflammation and strengthen your defense system. Think about the vibrant colors of fruits and vegetables. These aren't just for show. Those rich hues often indicate the presence of powerful antioxidants that fight off the harmful cells that can lead to colon cancer. Incorporating these into your meals doesn't have to be complicated. A simple smoothie with berries or a salad filled with leafy greens can be a delicious way to boost your colon health. The goal is to turn everyday eating into a habit that naturally supports the body's defenses. But it's not just about individual foods, it's about creating a balanced diet overall. Combining these cancer-fighting foods with whole grains and avoiding heavily processed items can significantly cut down your risk. It's a small investment with a big return. So, what's stopping you from making these changes? In the next part, we'll look at how early detection methods go hand in hand with dietary habits to catch any issues before they become serious. Early detection is a game changer when it comes to colon cancer, and the best part? It's within reach for most of us. Regular colonoscopies are the gold standard, especially for individuals over 45 or those with a family history of the disease. Think of it as your body's way of giving you a heads up before things get serious. While it might sound intimidating, it's one of the most effective tools we have. Skipping this test could mean missing early symptoms that are easier to treat when caught on time. Stool tests are another crucial step in the early detection process. These tests can reveal hidden blood, which might be one of the first signs of colon cancer. It's simple, non-invasive, and can be done right at home. By paying attention to these subtle symptoms, like changes in bowel habits or unexplained weight loss, individuals can seek help before it's too late. Early intervention is everything, and being proactive means giving yourself a better shot at a full recovery. The takeaway? Being vigilant and getting regular screenings is not just for those who feel symptoms. Even if you feel perfectly healthy, these tests could catch something you're unaware of. It's all about staying ahead of the curve. And speaking of symptoms, did you know they vary depending on where the tumor is located? Let's dive into that next, as understanding these variations could be the difference between early intervention and missing critical signs. Colon cancer symptoms aren't one size fits all. They actually vary depending on where the tumor is located in the colon. Tumors on the right side of the colon, for instance, may not show obvious signs at first. These cancers often cause hidden bleeding that gradually leads to anemia, making you feel tired and weak without knowing why. It's tricky because the symptoms can be so subtle, they're easy to brush off as something minor. But these changes, even if they seem small, are worth paying attention to. On the other hand, tumors on the left side of the colon usually make their presence known a bit louder. Here you might see more visible changes like blood in the stool, a shift in stool consistency, or even bouts of constipation. It's like your body's way of signaling that something isn't right. Abdominal pain is another symptom that pops up more frequently with left-sided cancers. If you ever notice these signs, it's your cue to seek medical advice, as catching these early on can make all the difference. Understanding how symptoms differ based on tumor location can help individuals know what to look for and when to act. It's like having a roadmap for what's normal and what's not. But what happens when these signs are missed and the cancer progresses further? Let's explore what advanced symptoms look like and why it's crucial to address them before it's too late. As colon cancer advances, the symptoms become more noticeable and harder to ignore, but they're also more severe. One of the most common signs at this stage is significant weight loss without any effort, an alarming symptom that's often overlooked. Along with this, fatigue sets in as the body struggles to fight the spreading cancer. Imagine feeling drained even after a full night's sleep. It's not just tiredness, it's your body signaling that something is deeply wrong. These signs are crucial indicators that need immediate attention. Another advanced symptom is the presence of visible blood in the stool. It's not just about a few spots. The bleeding can be substantial enough to catch your eye and indicate that the cancer is progressing. Additionally, tumors at this stage might grow large enough to cause an intestinal obstruction, leading to severe abdominal pain, bloating, and a noticeable change in bowel habits. It's the body's way of saying that things have escalated, and action must be taken quickly. It's crucial to recognize these symptoms early on before they become so advanced that they impact daily life. The more you know, the better equipped you are to react before the situation worsens. But while these signs can be alarming, there are still ways to reduce risk and even prevent these outcomes. So, what natural prevention steps can one take to combat colon cancer effectively? Let's dig into that next. Preventing colon cancer isn't just about medical interventions. It's also about embracing natural, everyday habits that make a difference. A diet high in fiber, for instance, keeps things moving smoothly in your digestive tract and reduces the chance of harmful buildup. Imagine starting your day with a fiber-packed oatmeal topped with fresh berries. Not only is it delicious, but it's also doing wonders for your colon health. Staying hydrated is another key factor. Water helps flush out toxins, so keep that bottle close and drink up throughout the day. Exercise is another powerful tool in your prevention toolkit. Regular physical activity, whether it's a brisk walk, a bike ride, or a simple yoga session, boosts your metabolism and reduces inflammation, both of which play a role in preventing colon cancer. And don't underestimate the impact of sleep. Getting a full night's rest allows your body to recover and function optimally. It's all about creating a lifestyle where healthy habits become second nature, reducing risks without making drastic changes. Finally, avoiding processed foods and cutting back on smoking can significantly lower your risk. The chemicals and additives in processed items create an environment where cancer cells can thrive, so swapping them for whole, natural foods is a simple yet effective step. Think about swapping out that afternoon snack with a handful of nuts or a piece of fruit instead of something from a vending machine. These small changes add up and become a powerful defense. So, what are you willing to adjust today to prioritize your health? So, after learning all this, what steps are you willing to take today to protect your health? It's all about making small, powerful changes, whether it's getting a colonoscopy, adjusting your diet, or paying attention to those early warning signs. Remember, your health is in your hands, and now you have the knowledge to make a difference. Don't let colon cancer catch you off guard. Be proactive. What are you going to change in your routine to lower your risk? Share your thoughts in the comments below. And if you found this information valuable, don't forget to subscribe to our channel and hit the notification bell, because staying informed is the first step to staying healthy. Let's keep learning together.